n'ogenda e Bulaaya oba ogenze ku kyeyo kyonna oba ogenze Dubai, Saudi Arabia, n'obeerayo for more than a year, you lose your immunity. Against malaria, you lose it. So when you come back home for a visit, oba for malaria prevention. So and how do we prevent malaria? So malaria, we prevent it. Okuziiza okufuna malaria to gamba wele mosquito net, treated mosquito net. But what kisobodde oba olina okosa malaria prevention devices nga osokosa mosquito repellent masanyalaze. You can use a mosquito repellent. You plug it into power, and then it reduces the mosquitoes in the house. On top of the repellent, you can still put a lotion on your skin, a malaria spray on your skin, or the jelly. No, malaria. Malaria repellent, mosquito repellent, that helps to reduce the mosquito bites. Because tugeza kukendeza ku dose jofuna from this mosquito bite. So also kusula mu net notako ka mosquito repellent masanyalaze. Also on top of that, put a jelly on your skin. Then on top of that, bobangoli mchaze wano netukuwa eddagala, you take it every week, Eloquin, or you can take Malaria until you leave Uganda, and you take for the next 3 weeks until you leave the country. Then at any time we get symptoms, omutera nkulumirira, oyinamu fever, please don't just treat. Nogenda nofuna Coartem from the pharmacy, you get Duocotoxin, have a blood test. Bioinage blood smear on lab. It's cheap. It's about 10,000 or 5,000 depending where you go. You can have it done at any laboratory. Nebakulaga how many parasites you have. Okay, it can easily quantify for you so that you can know how the severity of malaria. Okay, just headache, but you have about 100 mps per blood slide. That's severe malaria. So what is severe malaria? Waliwo malaria ono wa bulijjo, waliwo malaria nokamba ono si wa bulijjo, abadde mugumuko nnyo, ali severe. How do you know? What are those symptoms? For example, severe headache, and then omuntu okufuluma omutulo, kuyisa omutulo ogwa black, omutulo wa mutono gukendedde, omutulo nga mukwafu nnyo, omuntu n'azimba omubiri, ebigere oba amaaso, then munafu nnyo, okwesika, temperature ngeri waggulu nnyo above 39. Temperature is above 30, above that 8.5, like omwana wampima nga ali 40. That's a very high temperature. It's a severe malaria. Then bagamba neko lab kasaba gikola nga blood nga malaria parasites nyingi nnyo musaayi, bagamba this is severe malaria. Then also bobanga oli lubuto, malaria yabeera severe, tutagala owojjanja bisengo lubuto n'omala gambira ddagala ogasinga gynecologist. So ugenda olaba omusawo wo akujjanjabe bulungi mu butuufu. And then also kiraga severity, omuntu nga amaaso ganza okufuuka yellow, either ekyuma kiba kifuuse involved oba nga like red blood cells bali mu kuzimenya nnyo, that's hemolysis. So there are many forms. Then okubanga obutasa bulungi, obadde olina malaria ogenda okulaba nga bwe bakafula kitosa, olina you're coughing, you're out of breath, so we advise you ogenda mu ddwaliro. Those are signs. And when you have severe malaria, olina kubeera mu ddwaliro. IV medications, IV quinine, IV testosterone, depending on the Ugandan guidelines. So mukituukirire tuba advising bulungi kubanga malaria atta tosobola kukola self medication. You have to see your doctor to guide you better. And at the pharmacy here we have all those things. Doctor abakulabye, we can advise on how to treat. We can advise on when to go for the hospital. Thank you.